Hello everyone. Today we are going to talk about cognitive functioning. My name is Sandeepa. I'm a clinical psychologist.
I'm Sumit. I'm a senior resident in psychiatry.
So what we are going to talk about is really relevant topic when we see patients. So it is very important to do cognitive examination. So why do we do cognitive examination? The main reason is to identify if there is any kind of cognitive impairment in that person. So for that we use a few tests which can be asked to the patient when he comes to see you, and it does not take very long time. So we are going to demonstrate about it and tell you how you can do that with the patient. So when we talk about cognitive functioning, we need to take into account 5 major domains. So it covers orientation, attention and concentration, memory, intelligence, and finally the judgment part. So we are going to talk about each of them. So first we'll talk about orientation. So when we talk about orientation, there are 3 things that needs to be kept in mind: orientation to time, orientation to place, and orientation to person. So if the patient is right there, so right now with me, Dr. Sumit will act as a patient and I'll be the counselor. So I'll check the orientation. So what questions I'm going to ask him. So Sumit, can you tell me what time of the day is it?
It is around 12 o'clock.
Okay. So if the patient is able to correctly answer that, then we say that the person is oriented to time. If he gives some wrong answer, then we say that he is not oriented. So now next we are going to talk about place. So Sumit, which place is this?
On the man's.
Okay, so he has answered it correctly, so which means he's oriented to place also. In order to check for the person, we mostly ask some of the relatives who is around and ask that who is that person. So the patient has to respond who that person is. Since we don't have anyone, we are not going to demonstrate that. But you can ask the patient that who is the person with you. And if he says the relationship correctly, then we consider that he's oriented to the person also. Okay, now coming to the next point is attention and concentration, which is measured with the help of digit span test. So for this, I have written a set of numbers to the person because I'm going to ask him that. So here we'll ask for digit span, which is forward and backward. You can also ask for serial subtraction, or you can ask for days or the months in forward and backward order. So I'm going to demonstrate how we ask for digit forward test. So Sumit, now I'm going to say some numbers.
Yeah.
Listen to them carefully.
Yeah.
And when I'm done, you need to repeat the numbers in the same order. Okay. So for example, if I say 2, 5, you will say
2,
5. Correct. Okay. Shall we start?
Yes.
Okay. 5, 7, 3.
5, 7, 3.
8, 3, 6, 9.
8, 3, 6, 9.
Okay, so this way we'll go on increasing one digit at a time to see how much is the person able to understand. So when we give them a set of digit, and if the person is not able to answer it correctly, then we give them same digit again. So we give them 2 trial in case they fail the first trial. Okay. Now I'm going to demonstrate how we do digit backward test. So again, I'm going to say you some numbers. Listen to them carefully, but this time you will have to say in reverse form.
Okay.
So for example, if I say 3, 2, you will say 2, 3. Correct. Okay. Shall we start?
Yes.
Okay. 6, 1, 5.
5, 1, 6.
4, 1, 8, 3.
3, 8, 1, 4.
Okay, so he has been able to respond it correctly. So it is important to note that each digit has to be said at an interval of 1 per second, and basically the gap should be of 1 second, and the digits should be said in same sound. So you cannot change the sound. So it should be in a monotonous sound. Okay. Now, next we'll move on to memory task. Here we need to consider three things, which is immediate memory, recent memory, and remote memory. So we just described digit tests that can be also used for immediate memory. Now talking about recent memory, so any recent event that happened within 24 hours, so we can ask any question based on that. So for example, you can ask the patient, can you tell me what you had for your breakfast?
I had paratas.
Okay. So you can ask similar question, or you can also ask who visited you in the morning. So anything which happened in the last 24 hours, and you need to also substantiate it with the caregiver or the informant who has come with the patient. Now talking about remote memory. So for remote memory, you can basically ask something about the life events. So you can ask the patient, can you tell me your date of birth?
18/1/1986.
Okay. You can also ask, when did you get married?
1 year, 8 months back.
Okay. So that way you can clearly check if the patient remembers those dates or not. That will tell us about his remote memory. Now talking about intelligence. So this includes areas of general information, comprehension, arithmetic, or vocabulary, and you can ask them these kind of questions. So when we are assessing knowledge, it is important to consider the person's background as well, his educational qualification. So if the person is educated, you can ask him something about recent any current affair or any general fund of knowledge. So for example, you can ask, can you tell me who is the chief minister of Karnataka?
Currently, it's Kumar Swamy, HD Kumar Swamy.
Okay. Or you can also ask something like, can you tell me 5 rivers in India?
Ganga, Krishna, Godavari, Brahmaputra, Yamuna.
Okay. So the person is able to answer all these. That means his general fund of information is fine. If a person who is illiterate and comes to you, for example, a farmer comes to you, you can ask him regarding crops, which season, in which season, which crop grows. So it should be relevant to the person's background. Okay, now next we move to comprehension. So in comprehension, you're basically trying to assess how much the person understands. So for example, you can ask him questions like this. Suppose you're feeling cold, what will you do?
I'll wear a sweater.
Okay, so these kind of questions can help you understand how much he is able to comprehend. So the person was able to comprehend well and answer my question correctly. Now, talking about arithmetic. So we ask them few questions which require some bit of calculation. So for example, we can ask, suppose you have, you want to buy 8 bananas and each banana cost you 4 rupees. So how much money you will have to give to get 8 bananas?
So 8 4s are 32.
Okay, 32. So you need to see how simple and how complex the task is. So in such task, we'll give around 15 seconds for them to answer. So within 15 seconds, if he is able to answer, that means his arithmetic is fine. Now moving on to the next part, which is the abstraction. So for abstract and concrete questions we'll ask. So we'll start with something which is concrete. We'll ask, for example, we can ask, can you tell me difference between apple and stone?
Apple is edible, stone is not edible.
Okay, so the answer was correct, right? Now we'll go something to a little more abstract. For example, can you tell me the difference between praise and punishment?
Praise makes you feel good, punishment makes you feel bad.
Okay, so this we asked about the differences. We can also ask for similarity. For example, I can ask, can you tell me similarity between cat and dog?
Both are animals.
Right. So similar questions are asked to assess their abstract understanding. Now, talking about the next part, which is last, which is the judgment part. So in judgment, we need to consider three things again: personal, social, and test judgment. So for personal judgment, you can ask something like, what is your future plan? What are your goals? So this will help us understand whether the person is clear with his goals or not, and is he able to make correct judgment about it. Second is social. So social we assess by seeing their social behavior, how they behave in any kind of social situation. The third is test judgment. So here there are very commonly used two questions that we ask to measure their test judgment. So for example, you can ask, suppose your house is in fire. What is the first thing that you will do?
I will try to put water and call for help.
Right. So you can see that he has answered it correctly, like he'll try to put off the fire, or he'll try to ask for help or call a fire brigade. So these are some of the acceptable answers. So sometimes some people might say that I'll not do anything, I'll just be there. So it shows that his judgment is impaired. Another very commonly asked question is the letter task, where we ask the patient like this, something like this. Suppose you find a letter lying on the road with the address written very clearly. So, what are you going to do with that?
I'll try to post in the nearby post office.
Okay. So, again, he has answered it correctly. He said that he'll take it to the post office. So, these are some of the adequate judgment. So, we'll say that the judgment was adequate in this situation. Okay. So, with this, we come to an end of our cognitive functioning assessment.
So continuing with the mental status examination, so till now we have demonstrated about various steps that are involved in mental status examination. So the last part is insight. The insight is a very important component in the mental status examination. Basically, insight is we want to know what is the level of awareness about his illness in the patient. So here we can do clinical assessment of insight, wherein we ask about three components, that is whether the patient is aware that he is ill or not, and whether he is ready to accept the treatment, and what factor he attributes to. Whether he attributes to the factor within oneself, or he attributes it to some external factors for becoming ill. So some practical questions what we can ask to assess insight is, for example, I can ask, what is the reason for you seeking treatment here?
I think I'm not well.
Can you briefly elaborate on what is this not well means?
Not well meaning I don't feel good. I feel very sad most of the time. I don't feel energetic. My
So,
sleep has gone down.
yes. So do you feel you need some professional help for this?
Yes.
So you have also received the treatment in the past. So do you feel this treatment is helping you?
Yeah, it is. I mean, it is because last time also when I sought treatment, I was doing fine, and then I thought that since everything is fine, I stopped medication.
What do you think? Why did you begin?
I think it's because of not taking medicine and not continuing medicine.
So from what we are getting is the patient is accepting the fact that she is having some problems. She is also accepting the fact that she requires some professional help, and she is attributing it to not taking medications. So this is some basic steps we can do to assess clinical assessment of insight. Thank you.